We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country and beginning to increase again here in Florida, this leaves many residents questioning what we should do next. Face masks are required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from our state medical professionals, and joining me is Alvina, epidemiologist with the Florida Department of Health in Orange County. Alvina, it's good to see you. Thanks for being with us.
Thank you. It's good to be back.
So, Alvina, the numbers are starting to rise here in Florida and in Orange County particularly. What do you think is behind the rise?
So really, I think we've all been experiencing a little bit of pandemic fatigue. And so lately, in the last several weeks, the age groups that have contributed the most to the increase have been those ages 15 to 34. And those are essentially young persons who are out and about and not practicing their good pandemic precautions. What we can see as a change from July, previously, most of the about 30% of the cases could be epi-linked or at least tracked to a known exposure to a lab-confirmed case. And now what we're seeing is over half of the newest cases recently can be epi-linked, which means people are exposed to known lab-confirmed cases, and a lot of these cases have been within households. And so we've seen a lot of a multi-generational transmission within households. We know the virus is very transmissible, particularly if you're living in the same household with another person who is lab-confirmed positive and sick. And so I can see every day when I review the cases, I can see all the cases in Orange County, and I can see transmission that occurs, say, from child to parent, parent to grandparent, and even from grandparent to great-grandparents. So multi-generational transmission and small household clusters are essentially driving this increase that's happening now, which is particularly pertinent to what's coming up just in a few days or so, is the start essentially of the holiday season from here through January. So Thanksgiving is down the road, and we do want to get some messages out there about how to prevent this transmission, which could be occurring within a traditional, family gathering.
So what should we do? Because that transmission inside of households, then we're adding other people who may come for Thanksgiving, for Christmas. What should we be doing to stay safe?
So really, there are certain people who really absolutely should not go to an in-person gathering or to Thanksgiving dinner. And I hope this doesn't need saying, but I will say it anyways, is that if you are positive right now and you have not met those criteria for discontinuing self-isolation, then you should not go to an in-person gathering on Thanksgiving. So if you have a positive COVID test, don't go to Thanksgiving. If you are sick or experiencing symptoms that are COVID-like, you should not be at Thanksgiving. If you have a known exposure to a person who is lab-confirmed COVID-19 within the last 14 days, so you have been exposed to that person within the last 14 days, then you really should not be at an in-person gathering, because that is essentially the definition of quarantine. So you may have been exposed, and then within 14 days is the possibility where you may become infectious or develop an infection and thus be able to infect others, even if you feel perfectly fine and are asymptomatic. And if you have a test pending, say you went to go get a COVID test and you do not have those results yet, you should not go to an in-person holiday gathering. There are some guidances, so to reduce the risk as much as possible, we do recommend that you limit the numbers. If you are going to have a gathering in person, limit the numbers to something very small, or specifically persons who are living in your own household. Certainly, if you can consider a virtual Thanksgiving, which could be just as fun. Also, to make sure that you, if you can, outdoors is better than indoors, or at least increase the ventilation or circulation of air if you're going to have an indoor gathering. Certainly watch your distance, and so wherever possible, or as much as possible, maintaining good social distancing in a gathering and not entering crowded spaces or crowding people into an indoor space. And then, as always, practicing good hand hygiene and frequently cleaning and disinfecting objects and surfaces.
It's just 1 year. No, it's not forever. That's all we have to do. This is the season that a lot of medical professionals have been dreading, when the coronavirus meets flu season. Should we still get a flu shot?
Absolutely. That's absolutely. We had started the flu season back in October, and so getting a flu shot early will help protect you for the rest of the season, no matter what's circulating, no matter which types of flu viruses are circulating.
So, Alvina, can you give us what we should be doing? We know what the protocols are, but to hear it from you always helps. What should we be doing? How should we be treating the spread of this virus?
So I know I've said it a lot, and you've probably heard it a lot of times, but practicing the good pandemic precautions. And so I'll give some specific scenarios in relation to Thanksgiving. So things such as wearing your mask. So if you're going to have an in-person gathering within your household, please encourage people to wear their masks if they're not eating or drinking. So at times when you don't need to have the mask off, you can wear it and encourage others to wear it. Refrain from singing or shouting indoors with each other. That helps limit the spread of respiratory droplets. Performing good hand hygiene. And so part of that is, washing your hands before touching surfaces or before going to eat. And then certainly after coughing or sneezing. And then also watching your distance. So even within the household, it's still recommended that, say, if you can, seat people 6 feet apart or greater. Seating outdoors is better because of the ventilation and the circulation of the air. Outdoors is better than indoors. And then also limiting the number of persons. So specifically limiting the number of people that you gather in the house, and if you can, restrict the gathering to those you are living within your own household. It matters a little bit who you invite to dinner. You may have some relatives, maybe there's some young persons who are in the 15 to 34 age group who have not really been practicing good pandemic precautions. They're out and about, and maybe they're not wearing their mask all the time, or they go to crowded places. And so these are persons who, if they are outside of your household and not living with you, are potentially those who could be infective and bring it in, whether they're and be asymptomatic and not know it, and potentially spread it within your gathering.
Well, thank you for reminding us again. We appreciate you, and appreciate you keeping us informed from the front lines. Thanks for being with us.
Thank you, and have a good holiday.
You too. Thank you. We'll be right back with more. Stay with us. We'll be back with more. Stay with us. Let's get an update from our county medical professionals. And joining me is Dr. Yolanda Martinez, manager of Orange County Health Services Department. Dr. Martinez, thank you for joining us today.
Thank you very much for having me.
So, Dr. Martinez, what are the major concerns as we start to see the numbers steadily rise here in Orange County?
Our major concern right now is that people are sort of relaxing some of the behaviors that we have been asking all along for them to please follow, and that is not wearing a mask. Sometimes I go to the grocery store or other stores as I need something every once in a while, and I see people not wearing a mask. And the other thing is people gathering in groups. The other day I was driving home and I saw a group of about 20 to 25 youngsters, adolescents, maybe in their early 20s, just gathering very closely together, talking, laughing, and none of them were wearing a mask. And I became very, very concerned about that. So the social distancing, the wearing the mask continue to be just as important now as it was at the beginning of the pandemic, or more, because people are getting tired. They're having the pandemic fatigue, as we sometimes call it, and that can be dangerous.
You know, and now with the Thanksgiving and soon Christmas holidays coming, should we just follow the CDC guidelines and stay home?
I think for the most part, if we can, we should. I know it's very difficult. Thanksgiving is one of the holidays that's a favorite for everyone because they get to see their relatives and spend time if they haven't seen them throughout the year. And most of all, this year that has been so emotionally difficult for everyone. It's the time that we would want to be close to those that we love. But precisely because we love them is when we need to make that final sacrifice, that final push to say, no, let's wait. It's just a few weeks around the corner when hopefully there will be a vaccine available, and those individuals that are wishing and wanting to get a vaccine, those that are most vulnerable, will be able to be protected. So I think we need to be strong just for a little while longer and give it all we got and say, no, I'm going to be strong this year and not congregate with my family if I can.
If you can, exactly. And like you were saying with the pandemic fatigue, what would you tell people who are starting to tire, starting to forget about their masks and forget about social distancing? What would you tell them from a medical professional standpoint of what we should be doing right now?
Well, it's understandable. I think we're all going through that. We're getting tired of wearing the masks, et cetera. But again, reiterate that while we get tired of wearing the mask and doing some of these things that we have been doing for the last 8-9 months, the virus doesn't tire. The virus is out there and is looking for someone to land on to cause harm as one, tries to personify a virus. But we can't let down now our guard. We need to be stronger than ever and continue to fight. The help is on the way, as Dr. Fauci says, and there will be a vaccine soon that will help everybody try to normalize. It's not going to be immediate either. It's going to take a few months, but just by the same, the more we sacrifice right now, the more we'll be able to see our loved ones and enjoy life in the future.
Absolutely. Well said. Thank you so much for being with us, Dr. Martinez. And thanks for giving us
You're very
information
welcome.
from the front lines. We appreciate you.
Thank you. Thank you very much.
And we'll be right back with more. Stay with us. Global crises like this pandemic bring forward wonderful examples of heroism and selflessness, but many communities also experience higher instances of scams, frauds, and schemes. Joining me is Mark Batchelor with the Cybercrime Support Network to talk about some of the medical scams that we're seeing in Orlando and across the country. Welcome. Thanks for being with us today.
Great. Thank you for having me here. This is a good. Glad to be here.
Absolutely. So how rampant are the medical scams in Orlando, and in particular in Florida in general? Are they pretty rampant?
They are, and not just in Orlando, but nationally. The bad news is there's no clear picture on just how many there are out there at any given time. There are several data agencies, even dozens, to which people can report a crime, including the FTC and the Better Business Bureau and others. But the problem is the data isn't always shared between agencies, or they may use different terminologies to describe a crime, which gives us a tougher time to get a whole picture of the prevalence of the crimes in an area. But if we look at something like the data from the FTC, so far this year in Florida, they've received over 4,000 reports of healthcare-related fraud, and just in Florida. But that doesn't take into account if those are perhaps online shopping scams as well, because sometimes we see fraudulent sites trying to sell counterfeit goods. So putting together the big picture is often a little tougher. So what we're doing at Cybercrime Support Network is helping standardize reporting to get a better consumer data picture so we can understand these trends in real time. That way, law enforcement and policymakers are able to put together the necessary resources where they're needed, when they're needed.
So what are the different types of medical scams that you're seeing?
There are a whole bunch, unfortunately, and they, like I said, they're go through different categories. It could be online shopping scams, which we see a lot of, or it could be the old-fashioned imposter scam from somebody calling to say that they're from Medicaid, perhaps. With the shopping scams, we see things nowadays with COVID-19. We see the miracle cures that people are pushing. They're playing on people's heightened anxiety, worried about coming down with the disease or being sick. And because they want to protect themselves, they're a little bit more vulnerable to falling for this, since there is no cure right now. When there is a vaccine available, though, you'll definitely hear about it through the health department or the FDA or other trusted sources. So that's where people should be going for information. Similarly, criminals are playing off these fears by setting up websites that look like the real thing, but again, they're selling counterfeit goods, or they're promising to sell cleaning supplies or masks and other items that are hard to get. And so when you give your money to this site, which doesn't really exist, you don't get anything in return, and very often it's very hard to get that money back. What we did is set up a website with Google called scamspotter.org. To help people become a little bit more scam aware and to spot the red flags of what to look for so they don't fall for those things.
And because we are in this age of coronavirus, a lot of people are getting tested. Are there testing scams as well?
Yeah, unfortunately there are. COVID tests are and should be free in most places, but some testing sites are tacking on fees that are very questionable. It's always a good idea to check with your local health department. Orange County Health Department has been very good and very communicative, and they schedule days and times and can tell you where the sanctioned sites are to go get tested. There are legitimate organizations that aren't the health department that are helping administer these tests, but you should take the time to do your homework and check them out and make sure that they've been approved. Otherwise, you're not only going to get a false result, which could put you and your family in danger, but it could also be giving personal information and health information to people who you don't know.
And Mark, where are you seeing these scams? Are they online? Are people calling your home? Where do you see them happening?
Yeah, well, most people say that, where a lot of people think when you're talking about cybercrime, it's just your computer. But people are getting calls, like you said, they're getting emails, even texts from questionable sources. And of course, there's those phony websites and other counterfeit sources. So many seniors are already very familiar with receiving calls from people claiming to be from Medicare or other agencies. I know they always say they're from the IRS or from their healthcare provider. They have to be careful for that, because now we're seeing the calls and the emails pretending to be from the CDC and the World Health Organization, and these organizations that people are anxious to hear from right now. It's okay to hang up on those calls. If any information is available that's important, it's going to be on their website, and it's going to be available through the health department and some of our local leaders.
Yeah, they're not going to call you. You can, like you said, hang up for sure.
They're a little too busy to look up an individual's phone number.
Right. You know, we have so much competing information around these days. It's hard sometimes to know what's right or wrong. I would imagine that in this age, because of COVID, there are a lot of other scams that are happening as well, because there's so much competing information. Are you seeing scams in general not related to medical information going up as well?
Yeah, absolutely, because once the flood doors are open, everybody wants a little piece of the money that's available. Right now, there's a lot of CARES Act money available. People are unemployed, so they've got heightened anxiety, and so they're looking for ways to save money or get products and services that they need that they might not be able to afford. They've lost their health insurance, so there's a lot of health insurance scams out there. And again, that's your personal health information that's at risk. So you have to be careful for that. There's also phony online pharmacies promising good deals. Especially, this is especially sensitive to seniors because sometimes the cost of prescriptions are prohibitive. And so they look to see, the quote unquote Canadian pharmacies. And again, if these are counterfeit goods, it could have little or no of the active ingredient in there, which can put your health at risk or the health of a family member at risk. So these are not petty crimes. These are things that are life-threatening at times. So it's very important to keep an eye out for it.
And, you know, we mentioned hanging up the phone, but what are the, you know, major takeaways for the public when it comes to avoiding these scams?
The best thing you can do, you know, they say time is money. In the case of online scams, taking your time will save you money. Slow it down a little bit, do your homework. It's always good, like you said, to hang up the phone, but if somebody says that they're calling from your bank and the phone number looks like they're calling from your bank, they know how to do that. It's always good idea to say, I'll call you back, take a few minutes, and just call the number that's on your credit card or on your bank statement. If there is a problem with your bank, that person will tell you. And if not, they'll tell you you did the right thing and you saved some money by saving a few extra minutes, and that's fine. So don't be afraid to ask questions is the number one takeaway. Another thing I like to tell people is if there's something that's needed and somebody's promising it but wants payment by gift card, that's a huge red flag and one that we see too much of right now. Because you're not going to get that money back at all.
So if someone is a victim of a scam, where can they go to find out more information about what to do?
Well, the good news is there are people and organizations that want to help. So people shouldn't panic. For instance, our website, fraudsupport.org, has it's an online database of resources that's going to help people not only figure out the right places to report these types of crimes, but walk them through the steps of doing so. And then we can also give them information about recovery and reinforcement so that they don't have to do this again, that they can secure their systems. But there's also information about that residents may be able to get through dialing 211, which has a whole host of services available to residents of Orange County and Greater Florida. But they can also help you report to cybercrime and connect to resources that can help. So for instance, if there was a scam that affected maybe your credit rating, there might be a local credit repair agency that can help, or if you need counseling because of a traumatic event, because of cybercrime or any other crime, they can help you find counseling at low or no cost in the area. So it's a great resource. And depending on the type of crime, you can also file a complaint with the FTC, the Better Business Bureau, or the county's consumer fraud line. And for the national resources, fraudsupport.org can help you walk through that.
Excellent. Mark, thank you so much for giving this information, because, of course, we're getting toward the end of the year, and that's when a lot of these scams start up. So we really appreciate you being with us today.
I appreciate your time.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep us informed about the coronavirus. From local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.